Hey guys, it's Maggie and I am back for Walk and Talk Wednesday. I had an exciting morning this morning because I caught a butterfly just after it hatched, but it had blown up its wings with all the fluid, but it was still drying so it couldn't fly, so I actually took a little photo shoot with it. It was super cool and can't wait to share that with you. But yeah, we're here for Walk and Talk Wednesday, so obviously we're walking and we're gonna talk. Thankfully, we are getting some cooler weather. Like I had said in yesterday's video, it's cooling off just a little bit. The humidity is down, which is amazing, so it doesn't feel so awful walking outside. But we still have not had any rain. Yeah. Not even like a misting. So everything is dying and it looks horrible. Like the grass, it's just all brown and dead. I'm not really sure what to do about it because we can't be watering everything. So I'm sparingly trying to water my garden, but I don't want to like overuse water. So it's been a bit of a struggle. Anyways, with my butterfly, I released her after I took some photos. I did it really quick because I was like, I don't want it to feel stressed out or anything, and she seemed to like me. She was climbing all over me, but I put her on a sunflower just to get her wings dry because she still couldn't fly yet. She kept trying, but it wasn't happening, and yeah, so I just checked though. She's gone, so I guess she dried out and she flew away. Honestly, there aren't too many other flowers growing right now. I keep looking. We've got these guys. Yeah, that's pretty much all we have going right now. I might take a little bit of a longer walk today because I want to see the other side, see if there's anything growing there that I haven't caught yet. All right, let's turn around. So anyways, for today's topic, I actually got it from talking to my dad the other night. We were talking about in nursing school when I was learning ostomy care. By the way, every time that my dad and I have a call with each other, it lasts for hours long, and we basically review all of our lives every time. I was talking about nursing school and how I remember the day that ostomy care was taught, and I remember just being so shocked, like, this is the amount of time we're spending on this. It was like a couple hours long, and we all split up into groups to do one ostomy bag change together. And obviously my group, I think, had a little bit of an advantage because I, kind of took over and was like, oh, I have one, like, let me show you guys. And our professors didn't even come check on us. So yeah, but that was it. Editing Maggie here. I can't believe I forgot to tell this story while I was filming this, but as I'm editing this clip, I remembered this happening that same day in nursing school when we were learning ostomy care. So before we all separated into groups to practice our single ostomy bag change, they showed us, this is how they taught us. This is how they taught us ostomy care, which I actually think is fabulous. They pulled up YouTube and they showed Laura. I don't know if you know Laura. I will link her channel. I don't think she's active on there anymore. I see her active on Instagram, but they showed her ostomy bag change video that wound up on Tosh.0. And the funny thing was, I remember like dying in class because at that point I hadn't really told anybody that I also was doing YouTube, and my thumbnail, there was like a bunch of thumbnails of me next to her video playing in class. Is anybody gonna like recognize the fact that my face is on the screen right now? And nobody said anything, so I don't think they did, but it was in the recommended videos that like appeared next to YouTube videos, and I was dying. I was like, please don't say anything. Please do not say that that is me. And no one did, but I thought it was hilarious. Anyways, I love Laura. I've met her a couple of times, and I think I texted her or I messaged her afterwards and was like, oh my gosh, we used your video in nursing school. So anyways, back to the walk and talk. And I don't think that patients realize that with a lot of the different procedures that patients have to do on themselves, you know, for whatever surgery or whatever they have going on, nurses only receive so much education about it, and it's really where they learn is doing it in real life. And, you know, when I was a patient in the hospital, and I got my ostomy, I just look back at some of the things that the nurses did, and looking back, it's so clear to me that they had limited knowledge on ostomies, which is a shame, but I also understand it. Like, I don't know, what am I supposed to do? Force the professor to spend a week on it? I have no idea. You guys good? Hi, it's me. They came to the edge of the coop there to say hello, because they were like, oh, okay, you're not a hawk that's gonna kill me. We did have a couple more losses with the chickens. I don't know what's going on. The older ones are fine, but the young ones, I don't know. And I really wanted black copper Morans, and I think all of them died. So I'm worried that there's something going on with that breed. Who knows? In the hospital, I had so many experiences where I was like, do you know how ostomies work? Of course, I didn't think that at the time because I didn't know how they worked. But, you know, a year later, I was like, wait, no, that's not what they should have done. And I don't blame the nurses at all, because you're taught what you're taught. When a professor comes up with a curriculum for you, you kind of just go with it, because that's, what else do you do? And I get that there's extremely limited time in nursing school. Like, gosh, I kind of wish I had been learning about it for 4 years, like all throughout college. Well, 5 years for me, because, yeah. But I wish I had been learning about it all through college to kind of give that time to build that knowledge. Because I know there are so many procedures that would take forever to learn about, and you need real life experience to learn about them. But yeah, so anyways, there were a couple things that happened in the hospital where now I'm like, don't do that. Do not do that. Nothing that like harmed me long term, at least. Hi birdies, I'm sorry, I didn't mean to scare you. Whoop. Turn around. Just heard some birds like fly away. That sound effect wasn't very bird-like, but you get what I'm saying. I remember this is something that I was just very particular about, and it's one of the many reasons that I don't like clip-ended bags. I just don't think they're trustworthy. But I had a nurse empty my ostomy bag in the hospital just a few days after my surgery, and they forgot to clip the end of the bag. And I know that they forgot to clip the end of the bag because as I was standing up, I could see that the clip was completely not clipped, and it was already too late. So all down me, all over the floor, and I remember just standing there crying, just sobbing, because I didn't know what to do. And thankfully I was able to reach over to the call bell, and the front desk lady came on. I was like, my bag just exploded all over the floor. And then the cleaning people had to come, and I was mortified. I was so embarrassed. But like, totally, easily could have been avoided. But I know that's a mistake. Totally understand that. Happens to the best of us, but honestly, that's why I like the non-drainables, because I don't have to worry about, you know, did I close the end of it? I like Velcro a little bit better than clip because it does seem more secure, whereas a clip, you can hit it, your pants can push on it, and it can undo the clip. But yeah, but that nurse, you know, she came in, she cleaned it up. We did what we had to do, but I was still like, oh my gosh, what happens if this happens at home? And as I told you in my recent kind of embarrassing stories video, that did happen in my dorm room. So it didn't take me long to get away from the clips. Oh, and it was a clip that came undone in Zach's bed. So yeah, my 3 main reasons of not liking clip-ended bags. I had them open up on me far too many times or not be clipped to start with. So yeah, and then another experience that I had, and this one really just shows me that it was a lack of knowing how ostomies work, how to properly manage skin irritation. Essentially, I was having very bad leaks when I was in the hospital early on. Just couldn't control them. We didn't know why they were happening. And I would complain to the nurses, my peristomal skin is very itchy and burning. Now I recognize that as you're having a leak. But the nurse is there, you know, oh, well, you know, it's fine. We just changed your bag. It's fine. They'd glance at the outer edges of it. You're good. It's sticking. It wasn't sticking around my stoma. It was leaking. So every time that they would do a bag change, my skin was raw. It was really bad. And I thought that that was what life was going to be like with an ostomy. I was like, oh my gosh, this pain, this burning, is this the rest of my life? Not up for that. So I remember one particular instance. I remember the nurse's name and everything. She was fabulous. Like, she was fantastic, super nice. But when it came to ostomies, I don't think she knew what was going on, because my bag started to leak. Visibly from the outside, you could see my output draining out the side. And obviously, I know you guys know this, you change the bag. You don't try to do a patch job, right? You got to change the bag, because that effluent on the skin is going to burn it. And pretty quickly. It doesn't take long. 20 minutes, and that can cause damage to the skin. She wound up taking toothpaste and inserting it into where it was leaking. So like in the edge of my flange, just pushed a whole bunch of paste in there, which basically was paste mixed with my output. It was not good. And it just became more and more uncomfortable, to the point where I was like, we need to rip this thing off. And we did. And we saw my output like still leaking around the paste, and the paste sort of absorbing some of it and just sitting on my skin. It was like a tract of skin irritation to the outside. It was like a red line. Oh man. But it just goes to show you that nurses are only taught so much. And just to remember that when you're going in the hospital, that the nurse is not going to be perfect at every procedure. And also, they don't have real life experience with these different things we have to do to ourselves. In my case, ostomy care. They don't go home with these, and they don't live in the real world with it. They deal with it in the hospital. So what they know is limited. And to keep that in mind, I think, is very important for patients that, you know, have an upcoming procedure. If you can start educating yourself now, so you can help yourself post-op in the hospital, but also help to teach the nurses. I had many patients, like I had a colostomy patient where they taught me how they did their irrigations, because quite frankly, we did not do a lot of irrigations. We didn't have a lot of colostomies. We usually had ileostomies. So this patient taught me how she did her irrigations, and it was awesome. I was like, thank you for teaching me this, because I just haven't come across this. So remember that you can always teach nurses, doctors, whoever's working with you. I have a friend, Alyssa. She's partially unstuffed on Instagram. Every time that she's in the hospital and there are nursing students, she will gather the whole group in her room and do a bag change for them, which is amazing. I remember after my proctocolectomy, I think that was the only time I ever saw nursing students. I was so embarrassed. I was looking rough after my proctocolectomy. If you guys saw my photos, my face got really puffy because they lift you up, like your butt's in the air during surgery. And so all the fluid went to my face. I was a big puff ball. And oh my gosh. I was doing my rounds in the hospital hallway, and not only was it a nursing student in the hallway, but he was one of my nursing students that I had worked with on my floor. He had, gone to a different hospital, because you tend to go to a few different hospitals in nursing school. And he didn't recognize me. And I was like, hey. And he did a double take and then kind of was like, what happened to you? And I was like, oh, I finally got my colon out, because I kind of told everybody about my ostomy. So I was like, yeah, I finally decided to get my colon and rectum out, and yep, this is what I look like right now. Hopefully this goes away. I know I look terrible. So that was kind of funny. I was super embarrassed, because I was like, wasn't expecting to see anybody that I knew in this hospital when I'm recovering. But at least that was confirmation for somebody, like, hey, I actually do get surgery and I do have this disease. So, yeah. Oh my gosh. But, I've learned over the years, the medical profession does the best that they can with the knowledge that they have. So that's why, as a patient, educate yourself, advocate for yourself as best as possible. I know that advocating for yourself is very hard in many circumstances, especially when you're like post-op, sick, not doing well. But I thought I would share those experiences from my time as a patient and then looking back as a nurse. Anyways, I gotta go check on the dogs. Hopefully they haven't eaten anything in the house that they're not supposed to. They usually don't, but I hope that you guys are feeling great. I hope that you enjoyed this video. Please share some of your experiences with nurses, maybe not knowing all the stuff that they need to know for your care. And yeah, I will see you in the next. Bye guys.